So what is that tier system we hear more and more about? Welcome, I am your medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So what is this tier system and how does it work? And why should you care? Well, the tier system appears in both the pharmacy directories and for medical services. Let's start with those first. It is a system for members of an insurance plan to use top performing providers for better quality of care and better outcomes at a potential lower cost. For medical providers, it is a rating system to foster better results using less services. And the incentive, the better the rating, the more patients and therefore increased income. And overall, for insurance companies, it is a system to get better clinical results at a lower cost. In the pharmacy side of things, the tier system is a way to encourage genetic versions or less expensive drugs to be used instead of more brand name prescriptions with a higher price tag. The balance of affordability with appropriateness also determines that tier status. So how does it work? Well, the tier system being a rating by an insurance of every contracted medical providers, and yes, that includes facilities like hospitals, is based on data. That includes the cost per diagnosis code, the number of auxiliary services used, such as labs or scans, the length of a treatment, and, of course, outcomes. Now, the better the outcome or management for a chronic condition with fewer services, the higher the rating. Other criteria can be staff efficiency, whether a super specialist, meaning one with few or no peers in the state or country, or who treats a rare disease. Professional credentials, level of education will help a provider rate higher. Providers with more general scopes of practices, with less stellar track records, with more members' complaints, less time in practice at a less desirable location, less experience or skilled may be rated lower. How does that affect your care? Where a higher tiered doctor will or should provide better care for less. Your condition should be treated with less associated services, lead to quicker or better outcomes. You should be offered more skills and experience. But because less auxiliary services are performed and because the cost to use a higher provider is lower, there is an incentive for patients to go towards those tiered doctors. But of course, that may mean delays in getting an appointment, more rushed office visits, a busier staff, or more difficulty obtaining a response, access, or action in a timely manner. The more in demand, the less time for you. Lower tier providers may not be in such high demand, but should be well qualified nonetheless to treat a condition that is neither difficult nor super urgent and may offer longer visits and other advantages. For pharmacy, the formulary, which is the list of every drug and medical device covered as a benefit under your plan, they are usually divided in 3 tiers based on criteria such as cost, availability, proven results, and demand. Your cost will vary depending on each tier. It is therefore important for you to know where your prescription stands. Yes, your pharmacist can help. A drug can move from tier to tier throughout the year based on pricing changes, new generic options available on the market, drug shortages, or increased demand, as we've seen for Ozempic lately. Your insurance must inform you of any change in tier in advance so you and your physician can determine whether to continue treatment with the same drug at a higher cost or switch to a more affordable option. So what to do? Consider your options would be first. Is paying a few more dollars for a more convenient or faster appointment with a slightly lower tier provider worth your time, especially if your need is more benign? Do you trust your current physician no matter his or her tier? Will your condition require expertise and the specialized skill of a highest tier physician? What is important for you when picking a primary care physician or specialist? Do more research. An insurance company rating system is mostly set towards cost containment, may not always reflect patients' experiences. A Tier 1 physician or facility demonstrating poor customer service skills with more negative Yelp reviews, having issued with getting their billing right, or with an unresponsive, unprofessional staff may lead someone elsewhere, even if that tier is lower and the cost slightly higher. Ask your physician if he or she has prescribed a brand name or expensive drug. Is there a cheaper or generic alternative? And if there is no alternative, or if a prescribed drug is the only one you should take, ask your physician to file a request for a tier exception. Some good reasons would include medical necessity, harm if switched to another drug or version at this point in time, allergy to approved or cheaper versions, interference with other drugs, cheaper versions were tried and failed, shortage of a cheaper version. With documentation, requests are very often approved. Now some tips. As with so many things in healthcare, a little time and research can save you money. Trusting an insurance rating is one thing, but other patients' experience might be useful in your decision-making process. Your insurance will always note that all of its contracted providers have been screened, vetted, are qualified, and in good professional standing, regardless of their tier assignments. Physicians are not privy to insurance coverage, benefits, costs to you, or even the tier system. Do help them and your wallet by directing your care and prescriptions to options that are as effective but less costly to you. Do I need it? Is there an alternative? What is the goal here? Are always good questions to ask your physicians. You are not doubting their medical know-how, but only making sure that bankruptcy is not part of the treatment. Every provider should be sensitive to this. I thank you for watching. Your likes, comments, subscribes do help this channel grow to reach out to more patients out there. So, thank you.